Once again, welcome back to obstetrics and gynecology videos. We used to tell that if you are not giving sufficient amount of folic acid during pregnancy, the child may get the neural tube defects or open neural tube disorders. Today we are going to see how it is getting developed. Folate, actually we used to tell that it will prevent the neural tube disorders. Folate functions in single carbon transfer reactions. Actually, its main function is it is helping for the single carbon transfer reaction. And this folic acid or folate, it exists in many forms. Folic acid, the primary form, petroyl monoglutamic acid, which is the most oxidized and stable form of folate, but it is rarely available in food products, but it is available in vitamin supplements and in fortified food products. In natural food, it is very less. And the second form which is available is food folate, that is petroyl polyglutamates. Now let us see the connection of folate and the neural tube defects. Actually, the folate coenzymes are involved in the synthesis of deoxyribonucleic acid, DNA, purine synthesis, and it helps for the generation of formate into formate pool, and it amino acid interconversion with the conversion of homocysteine to methionine, providing methionine for the synthesis of S-adenosyl methionine. It's an agent that is important for the methylation. That is, it helps for the synthesis of S-adenosyl methionine also. Folic acid also plays an important role in the closure of neural tube. That process is known as neurulation. It helps for that also. There are two general and important biological effects for the folate. In that, first one is folate act as a cofactor for enzymes involved in the DNA and RNA biosynthesis. So that is mainly for the DNA and RNA biosynthesis, this folate is needed. And folate provides 1 carbon units for the de novo synthesis of DNA bases. That is, it helps for the synthesis of guanidine, adenine and thymine. That is, for the synthesis of DNA, it is giving 1 carbon molecule, 1 carbon unit. And folate requirements actually during the pregnancy, it increases rapidly because of the growing fetus. Thus, the folate deficiency during this period will interfere with the DNA synthesis, and it will inhibit the cells, and the cells will be unable to manufacture the DNA which is needed for the mitosis. So what will happen? It leads to the imbalanced growth of the cells, and finally that will followed by the death of the cell. So actually the folate mainly it is needed for the synthesis of DNA, if you are telling in shortly, and this DNA is needed for the mitosis, and if mitosis is not occurring, imbalanced cell growth and finally death of the cell also will occur. Next, folic acid also plays, already we have seen it has for the neurulation. There are two general other important biological effects for the folate. The second one, already one we have seen. The second one, folate is involved in the supply of methyl groups to the methylation cycle. The methyl group is used by the methionine synthesis to recycle homocysteine back into methionine. If any disturbance is occurring in the process, that causes hyperchomocysteinemia and shortage of methionine. Therefore, the cells won't be able to methylate important compounds like protein, lipids and myelin. So what will happen? Because of the shortage of this methionine, the cells won't be having the capacity to utilize the protein, lipids and myelin. So this folate is helping for the methylation cycle also. Thus, folate deficiency or genetically rooted error in folate metabolism cause developmental defects through the disturbances in DNA biosynthesis and in the methylation cycle. So actually this folate is affecting two processes, that is it is affecting the DNA biosynthesis and it is affecting the methylation cycle also. So it is important that we are supposed to give folic acid supplementation during the pregnancy. Maternal preconceptional use of folic acid supplementation reduces the incidence of neural tube defects in pregnancies at risk by at least 50%. And in order to become effective, this folic acid supplementation should be initiated 1 month before the time of planned conception and continued at least 12 weeks of gestation when the neurulation is complete. So till the neurulation process is getting completed, that is closure of the neural tube, this folic acid supplementation should be given to the mothers, and we should start this folic acid supplementation at least 1 month before the conception, planned conception. Next, prevention. For preventing, already we have seen that this monofolate is not available in the food products. So what we can do means we can go for the fortification of the food. We can increase the folic acid intake by the fortification of flour, pasta, rice and cornmeal. And health education should be given during the preconception counseling itself. And folic acid and vitamin supplementation should be given to the couples those who are planning for the pregnancy. And consume food folate from varied dietary sources of which contains folate include green leafy vegetables, legume, citrus fruits, liver and whole bread. So we can encourage these contains actually that polyfolate. So we can encourage the woman to consume these food items also. Along with the supplementation, we can encourage. And for the prevention of this neural tube defect, all women in the childbearing age who are capable of becoming pregnant can be given 0.4 milligram of folic acid daily. And to avoid the occurrence of neural tube defects, this is 0.4 milligram per day. And if someone is having risk, that is if they are having a previous history of affected child, the supplementation should be 4 milligram of folic acid daily. And we should start it at least 1 month before the planned conception, and it should be continued 12th week of gestation where the neurulation process is getting completed. That is 4 milligram per day. Drugs that antagonize the folic acid supplementation include trimethoprim and anticonvulsants like carbamazepine, phenytoin, phenobarbital and primodine. These drugs actually it antagonizes the effect of folic acid. So if the ladies are using these drugs when during the time of pregnancy, we have to be more conscious. When on anticonvulsants or antimetabolites, oral contraceptives have suboptimal folate status. Actually, it is better for them to use the contraceptives. And if they are using anticonvulsants, valproic acid causes neural tube defects in 1 to 2% of the pregnancy. That is, if you are giving this valproic acid during the pregnancy, the studies are telling that it is producing neural tube defect in 1 to 2% of the pregnancy. So the clinicians are recommending all the female patients in childbearing age and those who are taking anticonvulsants, they should take folic acid supplementation along with the anticonvulsant drugs. And for the prevention of this folic acid deficiency, we can go for the genetic counseling. We can conduct the antenatal ultrasonography, and if any neural tube defect, if it is there, we can identify within 12 weeks, and that pregnancy should be, it is better to terminate that pregnancy. And maternal serum alpha fetoprotein level also should be assessed, and if neural tube defects are there, means this maternal serum alpha fetoprotein level will be high. So these things you have to identify, and if you are suspecting the neural tube defects, it is better to terminate the pregnancy. For that we can give counseling and education to the couples. And this neural tube closure occurs during the 20 to 28 days of development. Therefore, advice regarding the dietary modification, supplementation and food fortification should be given in the preconceptional period itself. That is, it should begin 1 month before the conception and it should be continued in the first trimester. Already we have seen that. And studies have shown that the preconceptional folic acid supplementation can prevent the occurrence of 50% of neural tube defects in the child. So we can prevent this open neural tube defects like spina bifida, anencephaly to a percentage of 50% by this folic acid supplementation if you are starting 1 month before the pregnancy. So thank you for watching this video. See you once again with a new video.